Hey, this is Dr. Davis. I'm going to show you how to do lumbar spine circles. We call them carves. That's a controlled articular rotation, which just means that when you do this circle, we're doing it nice and slow, and we're going to get some muscle activation through this lower spine region. So the way this will look is we'll cross up our elbows, keep them glued to the chest, and we're going to draw the biggest circle that we can. Now, I'm doing it really fast right now, but you're going to do it really slow. So as we do this, what we're trying to do is isolate everything else in the body so nothing moves except this mid-back to low back region. That's lumbar spine really is what we're trying to target. So we'll pretend our elbows are magic markers. We'll try to draw the biggest circle we can, and I'm going to press my elbows into my belly button. I'm going to round through the low back. You see that my low back is rounding. That is perfectly safe. So we just round all the way down here. Notice I'm not bending all the way forward, right? Because that is coming from my hip joint, not my lumbar spine, my low back. So I want you to keep your hip joint stable. The way you can do that is squeeze your butt as hard as you possibly can as you're doing this. Press your elbows into your low back and then start to carve out the biggest circle that you possibly can, including leaning back. Biggest circle as slowly as you possibly can. This should feel like you're exerting some muscular effort, and you come back to center. You'll go in both directions, of course, and you're going to want to move very, very slow, so it should take you about 10 to 15 seconds to complete one circle. That's slower than most people think. The point of this is we want to keep your general range of motion, and as you get better and as you recover from your pain, whatever range of motion you have, you get a little more, a little more, a little more. Now here's the thing, is if you feel some pinching pain, especially if you're going back into the left, let's say you have left-sided back pain, you go back into the left and you feel a pinching pain in that low back, you're going to make your circle a little smaller in that area. You're going to take that circle and just take a little divot out of the circle. So now your circle is a little bit funny in its shape to take a detour around that pinching pain. But as soon as you get around that detour, you're going to resume the full nature of the circle in the rest of your range of motion. Point is, we want you to expand your range of motion each day a little bit, so at least you keep what you got, and then each day maybe you get a bit more. If you have problems, of course, come in and see us in the clinic.